The human eye is sensitive and easily damaged. Recognition and careful assessment of injuries to the eye are critical. Permanent loss of vision can result from seemingly minor injuries.
The eyeball is filled with a fluid called vitreous humor. This fluid helps to maintain the shape of the eye. The eyeball and the inside of the eyelids are covered by a membrane called the conjunctiva, which protects the eyeball from foreign material and permits the eyelids to slide over the eyeball.
Ultraviolet rays, usually from electric welding, can burn the membrane covering the eye, causing tiny blisters to form. The onset of pain can take several hours.
All right, Ken, I'm just going to have a look at your eyes here.
Thoroughly examine the patient's eyes to ensure there are no foreign bodies. Try to avoid using a pen light or bright light, as arc flash can cause the eyes to be light sensitive. Cold compresses can be used to ease the pain.
All right, we're just going to leave that on for a little while. All right, Patty, I'm just going to be covering your eyes. All right, so I just want you to lie there and try to relax.
If the history indicates a penetrating or protruding object in the eye, the patient requires urgent medical attention and will require transport by ETV or ambulance. Lay the patient supine and either sandbag or have a helper hold the head still. This will help limit the loss of the vitreous humor. Cover both eyes and provide support to any protruding object.
It's all right. It's all right, Shelley. Take your hand
With
down.
any
Good.
chemical
Just turn.
splash, start flushing the eyes as soon as possible. After flushing the eye for 30 minutes with saline or water, examine the eyes and remove any loose particles. During transport to medical aid, continue to flush the eyes if possible or apply cold, moist compresses.
In the case of thermal burns to the eye, treat like any other burn by cooling. If the eyelid is damaged, do not attempt to examine the eye. The attendant must always consider the prevention of further damage to the eyes as a priority.
Jerry?
Bev, what's wrong?
Hi, I've got some dust in my eye.
All right, just come and have a seat here in the chair. Just sit in the chair, and I'm just going to give you this little gauze to hold over your eye while I wash my hands. Good. So how did this actually happen, Bev?
Well, I was out working in the warehouse doing some sweeping, and I guess part of the dust got into the air and into my eye.
All right. Do you wear contacts?
No.
No? Do you wear eye makeup?
No.
No? All right. Have you used an eye cup before?
Yes.
All right. Going to fill one with
Use
solution.
water or sterile saline to rinse the eye.
All right, and I'll just get you to hold this for a minute. I'm just going to wipe around your eye in case you've got any dust or anything around there. All right, now you can use that. And you can mop up. Good. Well, I don't see anything in there. How's that feel?
It's still there.
Still there?
Yeah.
Have you tried pulling your upper eyelid down over your lower?
No.
No? Could you try that?
Yeah.
Instruct the worker to hold the upper eyelashes and gently pull the eyelid down over the lower lid.
No, it's still there.
Still there? Try it one more time. It usually works. Still there?
Yeah.
Yeah? All right. Well, I'm going to just examine your eye then. Just lean back. That's it. Are you comfortable?
Mm-hmm.
All right, and I'm going to be using a light. It's rather bright, so I'll give you a moment in between to sort of relax your eye. Can you just
Okay.
look up? That's it. And
Using a pen light, perform a careful examination of the eye to determine the approximate location of the object.
down.
Check inside the lower lid, upper lid, and both corners.
And out to the side.
If the object is visible, remove it using a moistened cotton tip applicator.
I can't seem to see it. Does it feel like it's anywhere in particular?
Feels like it's up high underneath the upper lid.
Top? All right, well, what I'm going to do is evert your eyelid.
In order to evert the worker's eyelid, it's important to be prepared before you start. Allow the worker to relax while you moisten several cotton tip applicators.
All right,
Have the worker hold these ready for you. Ensure the worker's head is resting against a firm surface and stabilize your hand against her cheek.
just separating. Just going to grasp your eyelashes. Down.
Once the eyelid is everted, maintain it in that position
There it is.
and using an applicator, gently wipe off any object seen.
Touch. All right. And look up. How's that feel?
Feels better.
Good. And I'm just going to have you reflush just to make sure there's nothing still in there. All right. You can give me this one. All right. Give me that and you can just mop up. There don't appear to be any bits of dust. How does it feel?
Good.
All right, can you just read that eye chart on the wall?
DLNPTERFZBDE.
Excellent. All right. Well, I think you can go back to work after we do some paperwork.
Okay.
So if you just come with me.
Loose foreign objects in the eye are a common occurrence in many workplaces. Careful management by the first aid attendant is usually successful in removal of the object, allowing the worker to return to work.